Most men delay seeing a urologist for erectile dysfunction, not because they don't care, but because they don't know what to expect. They wonder, will it be embarrassing? Will the doctor judge me? Will the questions be uncomfortable? These worries are normal, and they stop many men from taking the very step that could change their health for the better. But here's the truth. Your first visit is nothing to fear. It's straightforward, professional, and designed with one goal in mind: to help you understand what's happening in your body and how to fix it. A urologist isn't there to judge you. They're there to listen, to ask the right questions, and to guide you toward real solutions. In the next few minutes, we're going to walk through exactly what happens during that first appointment, step by step, so you'll know what to expect and walk in feeling prepared, confident, and in control of your health. The first part of your visit with a urologist isn't scary at all. It's simply a conversation. The doctor will sit down with you and begin by asking about your medical history in detail. They'll want to know when your erectile difficulties first started, how often they occur, and how severe they are. From there, they'll ask broader questions about your overall health. Do you have heart disease, diabetes, or high blood pressure? Have you noticed changes in your energy, mood, or sleep? These conditions often go hand in hand with erectile dysfunction, so understanding the big picture is key. They'll also review the medications you are currently taking. Many common prescriptions, like those for high blood pressure, heart problems, or depression, can contribute to ED. Knowing exactly what you're taking helps the doctor spot possible side effects. Finally, the urologist will ask about your lifestyle. Do you drink alcohol regularly? Do you smoke? How much stress are you under? Are you getting enough sleep? These factors may seem small, but together they can have a big impact on sexual health. Remember, this stage is not a test. There are no right or wrong answers. The more honest you are, the clearer the picture becomes, and the faster your doctor can guide you toward the right solution. After the initial conversation, the next step is a physical examination. This may sound intimidating, but in reality, it's quick, straightforward, and entirely professional. The urologist will usually begin with a general checkup, measuring your blood pressure, listening to your heart, and checking your weight and body mass index. These simple tests give important clues about your cardiovascular health, since heart disease and circulation problems are among the most common hidden causes of erectile dysfunction. Next comes a focused examination. The doctor may examine the penis and testicles to look for any visible abnormalities, changes in blood flow, or signs of hormonal imbalance. In many cases, they'll also recommend a brief prostate exam, which is done through a short rectal check. While many men worry about this part, it typically takes less than a minute and provides valuable information about prostate size, inflammation, or potential warning signs of cancer. The goal of these exams is not to embarrass you, it's to gather essential information. By checking blood vessels, hormone-related organs, and the prostate, the urologist can begin to piece together the possible underlying causes of your symptoms. Remember, every step is handled with professionalism and respect. The entire process is quick, discreet, and designed to help, not to make you uncomfortable. There is absolutely nothing to be ashamed of. After the conversation and physical exam, the next step is usually a series of lab tests and imaging studies. This is where the urologist can really begin to uncover the hidden causes of erectile dysfunction, rather than just treating the surface symptoms. One of the first areas they'll look at is your hormones. Blood tests can measure testosterone, prolactin, and thyroid hormones. Low testosterone may explain a drop in desire and energy, while abnormal prolactin or thyroid levels can quietly disrupt sexual health without obvious symptoms. Next, they'll check your blood sugar and cholesterol. High blood sugar points toward diabetes, which damages nerves and blood vessels critical for erections. High cholesterol and poor lipid balance can clog arteries and limit blood flow, not just to your heart, but also to the penis. A simple urine test may also be ordered. This can rule out urinary tract infections, kidney issues, or other metabolic problems that might be contributing to ED. For many men, the most eye-opening test is the ultrasound blood flow study, also known as a Doppler test. This painless scan uses sound waves to measure blood flow in the arteries of the penis. It shows whether circulation is normal or if blockages are restricting supply, a common but often overlooked cause of ED. Finally, depending on age and risk factors, the urologist may recommend a PSA test to evaluate prostate health and screen for early signs of prostate cancer. These tests are not about embarrassment, they are about answers. Each one helps build a complete picture of your health, so the urologist can identify the true cause of ED and design a treatment plan that goes far beyond quick fixes. Once all the information is collected from your conversation, your exam, and your lab results, the urologist will sit down with you for the most important part, the discussion and treatment plan. This is where you finally get clarity. The doctor will explain what the tests show, what the likely causes of your ED are, and most importantly, what can be done about it. Instead of guessing or trying random solutions, you'll leave with a clear picture of what's happening inside your body. The treatment plan is personalized. For some men, it may involve medications that improve blood flow and support erections. For others, if low testosterone or other hormonal issues are identified, hormone therapy may be recommended to restore balance. Lifestyle adjustments are also a key part of many treatment plans. Things like improving diet, increasing exercise, reducing stress, and getting better sleep. These changes not only help with ED, but also improve overall health. In certain cases, more advanced options are considered. This might include minor procedures, injections, or surgery if necessary. But remember, these decisions are based on your unique situation, not a one-size-fits-all approach. That's the value of seeing a urologist. You don't just get a quick fix, you get a customized plan that targets the root cause and helps you regain both confidence and long-term health. Your first visit to a urologist for erectile dysfunction is not something to fear. It's something to embrace. Think of it as your first real step toward understanding your body and taking back control of your health. This isn't about embarrassment, and it's certainly not about judgment. It's about answers, solutions, and a plan that is tailored to you. When you sit down with a urologist, you're not just addressing a symptom, you're investing in your future. You're protecting your heart, your hormones, your prostate, and ultimately, your quality of life. Every question you ask, every test you take, brings you closer to clarity and confidence. So don't put it off. Don't wait for things to get worse. Make the appointment. Have the conversation. Get the tests. Because the sooner you act, the sooner you'll find not only relief but peace of mind.